As a refresher, here's how contact tracing is supposed to work. When someone tests positive for COVID-19, you need to get in touch with their immediate family and everyone else they've been in close contact with. If one of those contacts tests positive, you start the process over again with that person's contacts. The county has hired more than 500 case investigators and contact tracers who are supposed to spend their days calling people who've tested positive for COVID-19 and then calling all of the people the sick person has been in contact with. Those people are told to get tested and stay home for 14 days. But despite these plans, the county's program seems to come up short. The disease continues to spread through our region, and contact tracers are only calling on average 2.2 people for each person who tests positive. I talked to UCSD epidemiologist Rebecca Fielding Miller about why that is. So we've heard how contact tracing is supposed to work. What can you tell us about how it's actually working?
I think the most important thing to know about contact tracing is it's really, really hard to do well. You have to get somebody who has never heard of you, might have a few reasons not to trust you. You have to call them up out of the blue, potentially give them some pretty bad news, ask them a whole lot of personal questions, and then get them to tell you everybody they've been around for the last 14 days. And then you have to get a hold of all of those people and do the same thing.
We have some numbers from the county about contact tracing interviews that I want to go over. They say they complete 76% of their interviews, which means when they're calling people who have tested positive for COVID and asking who their contacts have been. But they say on average they only get 2.2 contacts per positive case. So can you explain a little bit more what this means and what that says to you?
If you think about it, the folks who are at home all the time, who leave to go grocery shopping, those folks are much less likely to be infected with COVID. It's the folks who are being exposed a lot. Let's say you work at a restaurant or you work in a pharmacy or a bar and you're coming in contact with a lot of people, your odds of being exposed are a lot higher. So it is probably pretty likely that the people who are sort of in this pool of folks the county is trying to reach, those people have more contacts than the average person in San Diego County. Which is to say 2 is probably an undercount.
And so it seems like we're also concerned with the community outbreaks that the county announces every day. They say, bars, restaurants, offices, and so on. But then they say that that only accounts for 5% of all local cases. So how could that be?
So let's say there are 2 people who get sick in a gym. 2 staff members in a gym get sick. They go home and 4 of their family members get sick. That would technically not be an outbreak.
Contact tracing was supposed to be one of our big ways out of lockdown by keeping cases contained. But is a poor contact tracing program actually worse than having none at all? So in other words, if county officials say only 5% of cases come from outbreaks based on a subpar contact tracing program, aren't we giving people a false sense of security?
So when we are able to catch a potential flare-up in the community, whether it's at a restaurant or a child care setting or a gym, we can at least stop that from getting worse. And as we manage to bring the total case numbers down, as we manage to suppress the bigger wildfire situation, then contact tracing becomes even more important because we can stop those flare-ups before they start and the numbers get higher.
Thank you very much for explaining this to us, Rebecca Fielding Miller. We appreciate your time.